Tobacco causes morbidity and mortality and huge cost to the healthcare system and to the families of the smokers. Smoking cessation is the single most important behavioral intervention that a doctor can do in their practice. In this 7-part video, we will highlight communication skills useful in motivating patients to quit smoking. Patients need to know that smoking causes many other health problems other than lung cancer. Doctors also need to know how to counsel patients to quit smoking. We introduce practical ways of assessing a patient's readiness to quit and provide skills to assess them to quit. Research conducted by Quit Tobacco International has found that patients respond better to the doctors if the doctor's advice is relevant to their current health condition. That means that a doctor should not give just general advice that smoking is harmful to their health. Their advice should be specific to the patient's health condition, and they should also tell them how the smoking habit is not only affecting their health but also complicating their current health problem further. By doing this and by explaining to the patient that their smoking is also harming the other family members in the house, the relevance of the quit advice by the doctor is better appreciated by the patient. Illness is a teachable moment for a doctor, a time the patient is more motivated to listen. Once the relevance is established, some patients may immediately become concerned and be ready to attempt a quit, but some may still be reluctant or resistant to quit for various reasons. In this video, we will be presenting you the strategies and approaches for both these kind of patients. Before starting, we need to emphasize that quitting is a process which is easier for some people while not for others. As a clinician, the first thing you can do is to advise them according to their health condition and according to their readiness to quit. See the challenges which are present for quitting and also help the patients to meet these challenges by giving them concrete, doable advice. Doctors must further bear in mind that the health impact of smoking is not only on the smoker but also on the family members. So they should advise the smokers not to smoke within the household even if they do not quit. Secondhand smoke is very harmful to the women, children and the non-smoking members in the family. Okay, let us begin. The communication and motivational skills you will learn in this video will give you confidence in encouraging the patients to quit smoking. The following are the 5 basic communication skills that doctors use to encourage and support any behavior change. These skills may be used in a variety of manner by the doctors while encouraging lifestyle changes. These are some competency skills that every doctor should have. An essential of good communication is to quickly build up a rapport with your patient. Eye contact, facial expression and posture is important. A doctor needs to invite honest and free discussion with the patient in order to establish a trust and a partnership with the patient. Lecturing patients is often ineffective in encouraging behavioral change. It usually either closes their mind or makes them defensive.
Good morning, doctor.
Good morning.
Doctor, I have a problem that appears to be becoming worse.
Okay, tell me, what is the problem?
I am having a bad cough and it is difficult for me to do my work. I am working in construction and we need to be strong.
Yes, how long have you been having this cough?
About 5 weeks.
Okay, tell me the symptoms you're experiencing.
At first, I thought just a cold due to climate change, but then it began cough and the cough continued and became worse. Sometimes it even difficult for me to breathing.
Let me examine you. chest appears congested. I can see cigarettes in your pocket. How many do you smoke in a day?
Not that much, doctor. Half a packet now. Actually, since my illness, I reduced a lot.
Have you all noted the non-verbal cues and the honest and open discussion between the doctor and the patient? Open-ended question encourages a patient to give an answer which is more than yes or no, in detail, and also to reflect on their own conditions. If a patient is unable or too shy to respond to it, why don't you all give some choices or answers to them to which they can respond to? You will use both closed and open questions in your practice. For example, you may ask a question, do you smoke? Which would give an answer yes or no. But following that, you can ask a question, can you tell me something about your smoking habit? This will give you a little more detailed answer from the patient. A doctor needs to prompt a patient to provide more information in order to clearly understand his issue. If a patient says something vaguely, it may be misunderstood by the doctor. So by clarifying an issue or asking a question clarifying the issue, the doctor will allow the patient to reflect more and give you a clearer insight into the issue.
I heard you say that you want to quit smoking because of your children. Will you tell me more about that?
In the above case, we want to know what is the motivator. Is it the effect of the second-hand smoke on the child? Is it that the parent is becoming a bad role model to the child? Is it the cause factor? Is it shame? Or is it that the child himself or herself may start smoking? Restate or summarize as accurately as possible whatever you have heard from the patient. By doing so, you will highlight the important points and organize the scattered thoughts into a clear scenario. This will be heard by the patient and they will be able to reflect on their position. After reflecting back to them, always ask, am I right?
I cannot quit smoking, doctor. All my friends smoke. We take break together at work. I can't say no when they offer cigarette. It's our routine as friends.
So what you're trying to say is that you feel compelled to smoke because your co-workers smoke. You would feel embarrassed or left out if you don't join them. Do I have this right?
Yes, doctor, you're right.
Reframing statements provides the patients another way of looking at their smoking or quitting attempts by providing a healthy or a positive way of assessing them. For example, some patients may feel negative about their quitting attempts or about the relapse while they had attempted to quit smoking. But this can be provided back to them as a positive as lessons learned in an instructive manner. By reframing, you help them to rethink their behavior in new ways.
I only quit smoking for 2 weeks and then I started again. I failed to quit.
You quit for 2 weeks? That's a very positive step. The first 2 weeks are the most difficult in the quit response. Let's discuss the factors that led you to relapse and let's identify the challenges that you faced. Then together we can figure out a strategy and see that you're more successful next time. To begin with, let's see what kind of lessons you've learned.
This type of reframing opens the door to a second quit attempt, knowing all the hurdles they went through in the first one. All doctors should practice the 2 A's, asking the patients if they smoke and advising them to quit. If the time permits, they should employ all the 5 A's. The 5 A's is a well-recognized strategy used to identify the smoking behavior and also to assess the readiness or to quit of the patients after explaining to them the harms of tobacco use. If the patient is ready to quit, the 5 A's will assist the doctors in supporting the quit attempt and also giving them simple and practical quit tips. Some of you who are watching this video have already been exposed to the brief intervention clinical videos which illustrates the 5 A's. Some of you may be watching this for the first time. For both of you, if you want to know about the 5 A's, do visit our website which has got 14 clinical videos illustrating the 5 A's in the brief intervention for tobacco cessation. These videos are in English or in Malayalam with English subtitles. Here is a brief review of the 5 A's followed by a short demonstration. You will see part of the clinical videos which has been developed by QTI to demonstrate the 5 A's used by doctors. The 5 A's is a useful tool when the doctors have just 3 to 5 minutes to talk about smoking to their patients. Introduce the topic of smoking and get a brief smoking history from them. You can ask questions like, do you smoke? Since when? How many? And then you can go on to open-ended questions. There you can ask, can you tell me something about your smoking? Their response to the last question will give us an insight into how important smoking is to them and what are the challenges we will face for them to quit.
Mr. Joseph, you can tell me about your smoking habit. How much do you smoke in a day?
I'm not a heavy smoker like others in my office. Just a packet, not more than.
No, doctor. Till 3 minutes ago, he used to smoke 2 packets a day.
But not now. I smoke less.
So when did you start your smoking habit?
During my college days, I was 18 when I started. I used to smoke 3 or 4 in the beginning, but slowly I started smoking more and more.
Advise the patients by educating them about 2 things. First, tell them about the harms of smoking and how it is affecting their current problem. For example, the complications now or the complications which they can face in the future. Or maybe interference with the medicines or a future illness which they can expect. Secondly, tell them about the complications of the current illness using diagrams or analogies. For example, you can use clogged pipes to tell them about the reduction in the circulation and the oxygen content going through the blood. Or you can tell them about clogged filters which prevent the removal of toxins like in liver or kidney functioning. Project QTI research has found that people want to know how smoking causes the health problems and they appreciate when the mechanism is in a manner which they can imagine. These images are remembered in their minds and they help in their attitude towards quitting.
Heart disease, diabetes and stroke are actually diseases of the tubes or the blood vessels which takes nutritious supply to the various organs of your body. You take this as a healthy blood vessel. The chemicals in the tobacco does 2 harms to this blood vessel, these tubes. What it does is that the chemicals clog the blood vessels and also constricts it. So that you need more pressure to push blood through and the organs are devoid of its nutritious blood supply. So once it gets totally clogged like this, your organ will suffer whole damage.
Okay, and I thought it was just cholesterol that did it.
No, the chemicals in the tobacco also does the same trick.
Assess patient's willingness to consider quitting. In this phase, the doctor will assess the willingness of the patient to quit and also the readiness to quit. If the patient is ready to quit, then the doctor will go on to assisting the patient to quit. If they are not willing to think about quitting now or in the near future, the doctors need to use the 5 R's. This is a strategy which I will talk about in a later segment of this video.
Doctor, it is very difficult to quit smoking. Cigarette have become a part of my life and it helped me at work. It's suitable for me. I experience no cough.
I see many patients who think that smoking is suitable for them, but I also see the ill effects that it has on their health and their family. You've been smoking for a long time, and I do understand it's a very difficult decision for you.
Yes, doctor.
Okay, I've explained to you the complications that smoking can cause for your diabetes. But it's up to you to decide what you want to do. You know that smoking can cause many serious complications like poor wound healing and heart problems. I'm here to help you if you decide that you want to stop smoking. I have some leaflets here about the dangers of smoking for those with diabetes. You can read these, and when you're ready to quit, we can discuss how to go about it.
Here too, the doctor has to give information to the patient about the need for quitting. The doctor does not confront or challenge the patients, but provides the necessary information. Here, the doctor is planting the seed so that the patient starts thinking about quitting. The seed is the complications that the smoking causes in diabetic patients, like gangrene or blindness or impotence or heart attack. All this information is described in the booklet that the doctor provides. If a patient is ready to think about quitting or willing to do so now, the doctors have to assess the patients by helping them to overcome the challenges they would face. Match your assess to the patient's level of readiness and help them to come up with an action plan which is doable by them. I will give you some examples later in a minute's time when we take up assist as a topic in its own right.
Smoking doesn't just affect your husband's health, it causes heart problems for you as well. You know what is second-hand smoke? When your husband smokes near you, the smoke you inhale is called second-hand smoke. It increases the chances of having a heart problem by 25 to 35% for people like you who have never touched a cigarette ever in your life. So you can imagine the harm you do to your children.
Doctor, I have asked him to stop the smoking many times, even my young daughter. She hates the smell of smoke on him and inside the house.
We have more reasons to quit, isn't it, Joseph?
I'll try and cut down the number and then I'll quit.
Is there a special occasion that is coming up in your family soon?
Yes, doctor. 2 weeks from now, our daughter's birthday.
What do you think, Joseph? Will that not make a good birthday present for your daughter?
Yes, I will do it. I will cut down the number and then I'll quit on her birthday.
That is good. In that case, what we need to do is you have to prepare yourself. There are certain steps we need to take, and that book gives you some practical advice on how to do that.
Okay.
First 3 days will be little difficult, but if you can overcome that, then it will be smooth going, and you adopt those steps and get back to me and we'll help you through how you can achieve that for your daughter's birthday.
Follow up on whatever steps a patient is able to do so on the road to quitting. If the patient is ready to quit now, follow up to see what has been done till now. If they are thinking about quitting, follow up by seeing whether they are ready the next time you see them. Ask them what is holding them back and encourage them to quit by telling them the benefits that they would get by quitting. If the patient is not ready to quit now, then leave the door open for future discussions. Ask them that they can come and see them back when they are thinking about quitting, and that you will be only happy to talk about it then and encourage them. In all cases, give some educational materials to the smokers if you have them. Project QTI has got certain quit tip books and also booklets on specific illness, how my illness is affected by smoking, which you can download from the website. Never give up on a patient because they do not quit today. It may require bringing up the quitting advice for months or for years at end before you reach the right teachable moment. Arrange in such cases means agreeing that it's okay for a doctor to continue talking to a patient about his smoking habit as a part of his job as a competent doctor.
If you have more discomfort while quitting, come and see me. I will prescribe medication for your symptoms. But give the body 3 days to adjust.
So by doing this, my breathing will improve?
You will begin to see the change. We will measure it. After a few more weeks, the difference will be even more as your lungs and heart become stronger.
And for now, any kind of medication?
I'm prescribing a medicine for your BP. It was a bit elevated.
take this mild medication and stop smoking. And let's see the difference before I prescribe other medicines. Unnecessary medicine can themselves cause problems. Stopping smoking is the single most important thing you can do to avoid these problems. You can see the difference. We will do the spirometry again and see the results there. You will breathe better, have more strength, and food will be more tastier.
Let us take a closer look at the 5 stages of readiness to quit. It is important to understand where a patient is in the process of either thinking about quitting or taking action to quit. You need to understand how to respond to each stage of the patient. Not all patients are at the same level of readiness to quit. A good doctor will tailor his communication according to the level of readiness of the patient. By matching the type of assistance offered by the doctor to the readiness of quitting of the patient, the doctor increases the chances of the patient listening to them and going towards action in quitting from tobacco use. If not now, at least in future. Here are the stages of readiness to quit. Before describing this, it is important to note 2 things. Firstly, patients do not follow a linear pathway, that is, a stage-by-stage progression towards quit. Where a patient is in terms of readiness at any point of time depends on their life circumstances, their feelings, and their cognitive understanding about the risks.
Yes, I know. I should quit. But I cannot be bothered. You see, we all have pleasures that are not good for us. If I am going to die, I will die. For now, I will enjoy.
Okay, we all die, but should one suffer before death? The patients who I see having tobacco-related illness suffers for years together. Imagine the condition, being not able to attend any functions, visit children, or not even enjoy your tastier food.
Many people who have smoked for years, they are still healthy. I have an uncle who is in his 60s and he is still active.
These are the healthy ones whom you have seen. But you are not seeing the dead or bedridden. I see the unhealthy ones.
Secondly, it is important not to push a patient so as to alienate or distance them. When a patient is not ready to quit, it is the role of the doctor to give information and to ask questions to the patient so as to encourage them to reflect upon what is causing their health problem and how their ill health is affecting not only them but also their family members. Guided reflection is a means of creating a change in the thinking of the patients about quitting, motivating them to take the next steps to quit. The doctor needs to assess a patient's readiness to quit each time you meet and do a brief intervention. Here are the stages of readiness to quit. Pre-contemplation, that is, not yet ready or not willing to talk about quitting. Contemplation, thinking about quitting. Preparing, getting ready to quit. Taking action to quit. Recovery from relapse and a past quit experience. Pre-contemplation, not yet ready to quit or not willing to talk about quitting. This stage is usually characterized by a patient who does not want to talk about smoking. The patient is sometimes defensive or even questions the doctor as to why he should even be talking about smoking when he has come in with a medical problem which he does not see related to smoking. Some people just do not think about quitting because smoking is such a part of their life or an activity which gives them immense pleasure or a means of relieving stress. The goal with this type of patient is to both motivate the patient to at least listen to information about smoking which is relevant to their health problem, and also to let them know that it is as a part of your duty as a doctor that you are giving them this information. It is important to acknowledge that the decision to smoke or to quit smoking is the patient's own decision. Your objective here is to open the door to thinking about quitting. If not now, at least in future. Try and get the patient to consider your advice and ask them if you can discuss about their health concern later on when they are ready to talk about it. Please do not argue with the patient at this stage or preach to them about the general harm of tobacco. For cases that are very resistant, try and at least get the smoker not to smoke in their house around women and children by informing them about the second-hand smoke risk to the family members. Strategies to use to motivate these kind of patients, including the 5 R's, will be discussed shortly.
Doctor, I have very poor appetite. My taste for food is not there. Many days I feel very tired. Sometimes I have burning sensation in my chest. I feel my stomach is full all the time. Maybe gas.
Let me examine you. This is a very common problem that I see. It could be due to the diet you eat, the start of an ulcer, irregularities in the time when you consume food, smoking, etc. Smoking can cause all these problems. Do you smoke?
I do, but I don't think that's the problem. I've been smoking for almost 5 years. I never had this problem. This just started a few months ago.
Okay. Smoking can have a cumulative effect on the body. You have been smoking for 5 years, right? From my experience with patients, I can tell you for sure that such symptoms are very common in patients who smoke. Okay. Smoking interferes with digestion. It affects your taste and it can cause the weakness that you have been feeling. Okay. Quitting smoking will definitely help you and I can help you with that, but that is a decision that you have to make.
Doctor, can you give me some medicine for these problems? I don't think I can quit smoking. I haven't thought about that.
Okay, I can do some tests and give you some medicines. This is for your gas and acidity. But remember, the nicotine in tobacco will increase the acid secretion and affect your taste. These medicines are just for symptomatic relief and not a cure. For the time being, can I make you a request? Can you stop smoking within the household? So at least stop smoking within the household to protect your family members.
Yes, doctor, I can do that.
Good. Here are some leaflets about the harmful effects of tobacco on your illness. You can read that. When we meet again after 2 weeks, I will have your test results ready, and if you are ready to quit at that time, I can help you then.
Here too, the doctor has to give information to the patient about the need for quitting. The doctor does not confront or challenge the patients, but provides the necessary information. Here, the doctor is planting the seed so that the patient starts thinking about quitting. Now let's look at the second stage of readiness to quit. When a patient is thinking about quitting, it is important that a doctor explores with them when he is willing to do so or what is holding him from doing it now. This interaction with the patient takes longer than the previous one. Contemplation, thinking about quitting. This patient has just begun to think about quitting. Here the role of the doctor is to gently encourage the patient towards quitting and explain to him the relationship between his illness and the smoking. At this stage, the patient realizes some reasons for quitting, but he does not have the commitment yet to act for quitting. The goal with this patient is to establish the relevance of the quit, the need to quit because of their health condition, and also to identify and support the motivators which would lead to the quitting. Strategies include offering information about the dangers of tobacco use that the patient can imagine and the benefits they would get if they quit. Ask the patient if he is willing to consider your advice and would be able to go for a follow-up discussion the next time they see you. Or if available, you can refer them to a cessation clinic also. Discussing about the patient's motivators and barriers using the 5 R's, which we will be discussing shortly, will be very important at this stage.
Now you are on medicines for your chest pain. What would really help you improve would be quitting your smoking habit too. What do you think?
Yes, doctor. I have been thinking about it since my illness. But I need my first toilet cigarette in the morning, and smoking helps me with my stressful job. So I don't think I can quit smoking.
It is good that you are thinking of quitting. Smoking increases the risk of heart disease as well as the chest problem that you are having. When you quit, you will feel the benefits in weeks or months. You will be more active and you will breathe better. Are you willing to try to quit?
I will think about it, doctor. But I am afraid I will have constipation if I don't have my first cigarette in the morning. It has happened before.
It is good that you are thinking of quitting. When you are ready, I will prescribe you some medicines for your constipation. Here is a booklet that is a guideline on quitting smoking. You can take it home and read it to understand the processes of quitting smoking. When you are ready, I am here to help you.
This patient could be assisted further by using the 5 R's which identify motivators and barriers to quitting. Preparing, getting ready to quit. At this stage, the patient is ready to quit, and the role of the doctor is to help the patient to prepare and come up with a concrete plan to quit.
Doctor, I have realized that smoking has been one of the reasons for my asthmatic attack. I would like to stop this habit as soon as possible. I have already reduced the number that I smoke.
That's a very good decision. You've taken the first step towards quitting. When do you think you could completely stop?
Maybe in a month's time, I will quit completely.
What's preventing you from stopping now?
Doctor, I have been smoking since 20 years. How can I stop in a day? I used to smoke after my meals. When we friends gather together, we smoke. But I try slowly to reduce and then break this habit.
That's good. That's good. But let's discuss what we can do to help you during the times that you want to smoke most. Perhaps after your meals, you can try and divert your attention by chewing some gum, cardamom or cloves, and maybe you can distract yourself by watching some TV or telephone a friend. This can help you through those moments. What do you think?
Doctor, if I didn't smoke after my meals, I'll have a bad taste in my mouth. I'll try cardamom chewing.
Yes, that will certainly help. I'll also advise you to avoid your friends who smoke during the next few weeks. Perhaps you can meet them before or even after their smoking session and tell them that how the doctor has advised you against smoking because it is worsening your asthmatic condition.
Okay, doctor, I can do that for a few weeks.
Taking action to quit. The patient in this case has already taken action to quit. The doctor reinforces the patient by reminding them of their success and also the strategies that they have personally developed to avoid craving.
How long have you been successful in quitting smoking?
2 months.
And how are you feeling now?
Yeah, I feel better, doctor. I can breathe easier now. My cough is less. But sometimes I have this cravings for smoke. Will this go away?
It will reduce over time. For many people, these cravings come and go for a while. You have already had success in not smoking for 2 months. What did you do when you had these cravings?
I tried to keep myself busy by doing different activities. I read books, did some work around the house, called my friends, played with my children. I tried to do whatever possible to distract myself.
So, by diverting attention to other activities, you can restrain yourself from smoking.
Yes, I stopped smoking till now, and I do feel healthier. My family is very happy that they don't have to be exposed to the smoke, and they tell me this every time.
Quitting smoking for 2 months is not a very easy thing. Congratulations. You can be a role model for other smokers who want to quit. Your family should be very proud of you.
Recovery from relapse and a past quit experience. The next case is that of a patient who has relapsed to smoking after quitting for few months. Here, the role of the doctor is to remind him of the need for quitting, to reflect with the patient on the lessons which led to the relapse, and to encourage the patient to quit once more. Reframing is a communication technique which changes failure to partial success. Quitting for many is a process which involves several quit attempts followed by relapse. Many successful quitters have quit several times and they had multiple relapses before they went on to long-term success. Therefore, when a doctor is assisting a patient who has relapsed, they should reframe their experience as partial success and a learning experience. Congratulate the patients for being quit for whatever period they were tobacco free, and also on the strategies that they had used successfully to avoid using tobacco. Next, encourage them to identify the physical, psychological and social reasons for them to start smoking again. Discuss about the strategies which can be used to overcome these challenges, and also encourage them to try and quit again.
Take these tablets 3 times after food. It will give you relief for your gastritis. Is there anything else I can help you with?
Yes, doctor. I have started smoking again. I quit completely for over 6 months. It's this trip I took with my friends that led my smoking again. It was a hill station and cold, and when friends offered a cigarette, I took just one for warmth and company. But then when they offered again, I could not refuse. And after days, I was smoking 4-5 cigarettes and slipping back to my old habit of smoking.
This often happens to many people who are trying to quit smoking. But what is commendable is that you were able to quit for almost 6 months. Now, it shows the first few days of quitting, the first few weeks of quitting is always the most difficult. But you have gone well beyond that. So it shows that it is possible for you to quit. What are the strategies that you used before to quit smoking?
At first, I had shifted from smoking to chewing tobacco, thinking that it is less harmful. But after you informed me that it is bad for my health and for my gastritis, I left it. I drank water or chewed cloves whenever I felt smoke.
I'm glad you took my advice. Shifting from smoking to chewing tobacco is not a good strategy at all. It will badly affect your health, especially your digestion. Your other strategies seem to have helped. Why don't you try them again?
Yes, doctor, I can try.
What was the real reason for your relapse?
Smoking with friends. But I thought just one cigarette. But it would be okay.
And what did you learn?
Smoke even one cigarette, the craving returns.
Even a single puff can trigger a relapse, especially when you're trying to quit the habit. Under no circumstances should you even take a single puff.
Yes, doctor. This time I'll try sincerely.
If you can quit for 6 months, you can surely quit for good. Remember, it is best to avoid your friends who smoke, especially during the first few weeks when you're trying to quit. Good friends will always respect your decision and try and support you through that. But those who don't are definitely not your true friends. When they offer, let them know your reasons to quit and say a firm no.
The doctor is encouraging to the patient, reminding him of how he quit smoking previously for months. His failure is reframed by the doctor as partial success and a learning lesson so that he knows what not to do the next time he tries to quit.